The additional barrier for someone who's experiencing voices is they may hear a voice which doesn't sound like any of those people. So they're not even able to say, oh yeah, that is that fear that I've carried with me. Right? But that it sounds like someone completely different saying you're going to fail at this task or something bad will happen to you if you kind of get out and try to do this thing. And they're not able to kind of connect all of those dots. The idea was that if you could create an avatar that sounded like the voice that the person heard, and for people who have a very clear picture in their head of like, this is the voice, it's, the voice is Bob. He used to be my neighbor. This is what he looks like. This is what he sounds like. This is why he's doing this thing to me. So that would be an example of a well-characterized voice. And the idea was that if you can create an avatar of the voice, then you can kind of use, say, some of those like kind of assertiveness and self-compassion skills to teach the person to like stand up. How do you want to respond to the voice in a way that feels true to you, that you feel good about, and they can practice and they can actually respond to the voice in that way. So it starts off with the therapist just basically verbatim saying what the voices have been saying to the client.
And so just for the listener, when you say avatar, you literally mean a computer generated.
Yes. So there are some pieces of software now that are available that will allow you to kind of like create the face and, skin tone, face shape, hair color, and so on to look a little bit like the person imagines the voice to, and using a voice morph to like kind of increase or decrease the pitch, sort of treble, wobble, and so on.
And like, will patients usually be like Bob, my neighbor, or will it be more generic, but they can describe, okay, it's a man, he does have dark hair, he has this sort of a look, and then he can work with either the therapist or a technician with the software to help develop an image of that, I don't know, non-specific.
Yeah. So the clearer the sense that the person has of what the voice looks like and sounds like and why they're doing the things they're doing, the more clearer target that we have for treatment. So this approach to therapy is really helpful for people who have a dominant voice, which they have these kind of beliefs about, right? And so we work with them to like build that avatar on the computer. And the study that we're doing, we're actually doing a VR version of it. So then they put on a VR headset and they see that figure, and we can kind of have the figure in kind of different settings. So like a living room or on a bus, and then the mouth moves as the therapist speaks, and the therapist can switch between being the therapist, so sounding as they would, and then you press a button so they sound like the voice that the person hears. So when we're building the avatar, we're like, what does the voice sound like to you? And we kind of practice that, and then we know what the voice has been saying to them. So let's say the voice says, I'm going to hurt you if you go outside, and they see it in the living room, then we've kind of practiced it. And then we might kind of practice assertiveness with them. We might say, how might you want to respond? What would make you feel more powerful and in charge? And so then the person can be in the VR setup, see the figure as they imagine it. It says, I'm going to hurt you if you go outside. The person practices saying, well, you know what? I think I'm going to be okay. I'm going to push myself to go outside anyway, right? And they practice doing that a few times. They might try it in different ways to find a version that feels authentic and feels assertive for them. We record those interactions so that they can listen to it when they actually hear it outside of session as well. And then it goes from responding to the verbatim voices to trying to build conversation, hopefully with some of the folks where it would be that, we can understand, like, there was a time in your life where maybe you felt unsafe and you didn't feel like you could go out, but now that's no longer true, right? So they could have a corrective experience with the avatar that they may not be able to have with the voice that they hear, right? Because a therapist can kind of guide that interaction.